I think when prescribers are hesitant to use a compounding pharmacy, a little bit of history can help their understanding about where we came from and where the profession is going and how they can exercise the availability of a compounding pharmacy in their practice. For starters, compounding is the basis of the practice of pharmacy. Pharmacy originally dispensed only custom-made medications, and then with the advent of manufacturing, everything, 99.9% of it became a manufactured product. And then more recently, over the past 30 years, there's been more demand for customized dosages that fall between the cracks of what is available commercially. So it has been a present and growing aspect of the practice of pharmacy, very niche, and it's available to prescribers who understand that it is available to them. And then from there, it's a matter of understanding how to utilize the different tools available through an accredited quality operating. What I like to say to doctors and patients, if our accreditations and credentials don't really make sense, what I'd like you to know is that more than anything else, our accreditations, our pedigree, give you peace of mind. They mean that you don't need to worry about the details because we've done that. We understand what the requirements are for excellence in compounding, and we deliver on those. We don't just say that we do. We don't strip the quality out for the sake of price. We give what we say we're giving, which is quality and excellence.